What state policymakers often focus on is the actual dollars involved, because 10% of a very large number is a lot of money. And I think a lot of the states that are hesitant about Medicaid expansion, they look around, they don't see a lot of money growing on trees in their state budget. If you're wondering why, if you live in a state where schools are underfunded and roads are underfunded and emergency services are underfunded, it's typically because Medicaid skyrocketing costs have limited the fiscal flexibility that states have to fund their other priorities. And taking on an additional responsibility in the Medicaid program makes that harder, especially when you consider, it depends on the state, but in a lot of states, the actual amount of net coverage expansion you get from Medicaid is not as high as people think, because in states that don't expand Medicaid, the eligibility for the Obamacare exchanges actually expands to people from 100 to 138% of the federal poverty level. And a lot of research, some of it done at Harvard, shows that there are actually a lot of people who have employer-based coverage or have offers of employer-based coverage who drop out of employer-based coverage to take Medicaid when Medicaid is expanded. So the net coverage expansion is not as large, but the fiscal expansion at the state level is significant.